The fifth and final segment of this presentation focuses on implementation of these statutory changes. A threshold question, and a very reasonable question, is that this set of statutory changes contemplates the creation of new community-based programs. How will those programs be paid for? The statutory changes that we're discussing contemplate that the Health and Human Services Commission will establish a matching grant program for county-based community collaboratives. This will reduce recidivism, arrest frequency, and incarceration of persons with mental illness, and again, reduce waiting time for forensic commitment of persons with mental illness to a state hospital. To receive grant funds, the community collaborative must include a county, a local mental health authority that operates in the county, and each hospital district, if any, located in the county. The collaborative also may include other local entities designated by the collaborative's members. And this language is a reflection of the fact that there may well be a wide variety of local environments and local stakeholders. The recognition is there that the resources and the identity of stakeholders is not going to necessarily be the same in a large urban center versus a rural center. And the statutory funding mechanism is devised to reflect that reality. Counties with less than a population of less than $250,000 must provide funds from non-state sources equaling at least 50% of the grant amount. Counties of population more than 250,000 must provide funds from non-state sources equaling 100% of the grant amount. Again, the concept behind this is to create a collaborative partnership towards the goal of creating local treatment options. Additionally, the community collaboration grant mechanism creates a matching grant program for community mental health services. As with the prior mechanism, the match amount is going to be stair-stepped according to the size of the population. But the basic concept is the same, requiring collaboration with local mental health authority representatives and stakeholders. The immediate implementation steps to be aware of primarily focus on the effective date of the statute. It goes into effect on September 1, 2017. A number of resources are available through the Office of Court Administration website in order to provide explanation and examples of how these specific statutory changes are going to work. Bench materials include a competency restoration checklist and a flow chart for initial screening and assessment and competency restoration. In addition, the slides from this presentation will also be available. It is contemplated that there will be additional educational opportunities, primarily through judicial education seminars in the coming months, but these are resources that are immediately available for reference in light of the September 1, 2017 effective